Hello, my name is Rachel Kessler, and I'm a nurse working at the Wesley Long Emergency Department. Today we'll be covering some education on the CIWA score. Just as a refresher, CIWA stands for the Clinical Institute Withdrawal Assessment for Alcohol. This is a validated tool for assessing the severity of alcohol withdrawal symptoms and is used to calculate the dose of Ativan needed for a patient in withdrawal. It covers 10 symptoms that can occur during the detoxification process. Each of these symptoms, with the exception of orientation level, is rated from 0 being no symptoms to 7 with maximal symptoms. The sum total of all their symptom scores is their CIWA score. So you might be asking, why have we decided to do education on the CIWA assessment now? The big reason is because of our new triage protocols. With the new protocol, whenever we have a patient arriving wanting alcohol detox, who is not having suicidal or homicidal thoughts, or is under IVC, the only thing we'll initiate at triage is a CIWA assessment. Be sure to do a CIWA assessment as part of triage. If you find the patient has a CIWA score of 8 or below, the plan will be that provider gives them resources and then discharge. If you find their CIWA score is over 8, you will then order some lab work and have the provider determine the plan of care. Otherwise, we will continue using the CIWA assessment to determine the severity of alcohol detoxification symptoms and the need for Ativan per the CIWA protocol ordered by the physician. To record a CIWA assessment, go under the Psychiatric Assessments category and click on the CIWA Alcohol Scale. This will cause the CIWA assessment to pop up. Enter the patient's blood pressure and heart rate, and then just go down the list and click on the appropriate assessment findings. After you've filled out your findings, your CIWA total will show up in the bottom box. You can then use this score to determine your plan of action. A score of less than 8 shows the patient is having mild symptoms. A score of 8 to 15 shows that they are having moderate symptoms and will benefit from having some Ativan. A score of over 15 is a sign of severe withdrawal, and the patient may have to be medically admitted in addition to medication. While most points on the CIWA scale are clear enough for you to determine their severity, there are a few categories that can be confusing. One such category is tremors, which uses terms like moderate or severe without giving a more detailed description. With minor tremors, a 1 or a 2, you can feel fine flutter-like tremors when you touch their fingertips. That's not obvious on the general examination. With moderate tremors, a 3 or a 4, a patient could bring a cup of water to their mouth with one hand, but you can see a noticeable tremor when they do this. With a severe tremor, a 5 or a 6, a patient needs both hands to bring a cup of water to their mouth. A 7 would be if a patient is having full body tremors, which makes it impossible for them to stand unassisted and can even cause their tongue to tremor. Sweating can be another confusing category. With minor sweats, a 1 or a 2, you can barely feel some sweat on their skin, but you can't see any sweat. With moderate sweating, a 3 or 4, the patient feels sweaty, their clothing is slightly damp, and you can see some visible sweat on their skin. With severe sweating, a 6 or a 7, the patient feels obviously wet, and their sweat soaks through their clothing and bed linens to the point where they should be changed. The categories of anxiety and agitation can initially seem to overlap. Remember, with the anxiety category, you're assessing more of the patient's subjective feelings of anxiety, which can range from 1 being slightly anxious to 7 being similar to a really bad panic attack. Agitation evaluates more of the objective findings, such as the ability to stay still, tossing and turning in bed, and pacing. Just a quick reminder about the CIWA protocol for dosing Ativan. Finding your Ativan dosage using your CIWA score is similar to dosing insulin off a sliding scale based on a CBG. To determine your Ativan dosage, find which CIWA score range your CIWA score falls underneath. This will tell you how much Ativan you should give. Note that both the PO and the IV Ativan are listed on the MAR, but you will only be able to choose one route to give the patient, and the other one will be listed as an alternative. This concludes our presentation. If you have any questions, you can contact me or Denise through. Thanks for listening.